Hello students, we will discuss today another operative skill, that is tissue approximation, what is called as subcuticular suturing. It's approximation of the skin. You can use simple interpreted, you can use mattress, vertical mattress, like that. But one of the things where in a clean surgery, you can use subcuticular suturing. Usually absorbable suture is used, usually monocryle is used. It contains 75% glycolite and 25% E-caprolactone. Glycolide is a hard one, caprolactone gives a soft component. So very smooth suture material, easy maneuverability, easy to pass. Usually 3-0 monocryle is used for this procedure. Just have a look how exactly it is done. See that the first bite is taken from the dermis, the underneath the skin, and it is taken from the opposite white. You can see the white area, that is dermis. Is the monocryle suture material, monofilament it is, absorbable, and put a reef knot, front, back, front. It's a reef knot, unlike granny front. So cut end, it's a continuous suture, remember. So cut end is, tail end is cut, and take bite from the dermis alternately, ipsilateral side, contralateral side, ipsilateral side, contralateral side, like that. See that? Bite is taken that, and it is moved towards this side. Same thing, alternately like this, zigzag it comes like this. In the, see that has come up to that. I have clipped the video actually. Like that it comes and reach to the end, other end. And other end you put the knot. So you don't require to remove it because it's absorbable. Sometimes knot they'll prick, they'll say. So if that may be knot, may have to cut after 2 weeks. Most of the time it get is absorbed, non-irritant, very good suture material. Contains glycolide and caprolactone, 75% glycolide and 25% E-caprolactone. So very smooth suture material, very nice suture material, least reactive. So end you see that, you put the bite from the both side, take that, take the bite from the both side. See that? Then to the loop is a terminal knot. So beginning knot, terminal knot is put a loop that, again put a reef knot that, then cut it. So that is the subcuticular suturing. Students, it's a very commonly done procedure. Skill in Oxy they will ask you, Viva also they will ask you, and once you are intern or surgeon or doctor, you may have to do this procedure during course in different procedure. Clean surgery only it is done, without any infection, without any edema. So students, I hope you understood this subcuticular suturing lecture and video demonstration very well. Thank you very much.